Hello, everyone. There are a few myths that I want to dispel about healthcare in the United States. It's painted in the media and other places as a profit based system solely and without consideration for people, but that's far from the case. I want to make the case for the United States healthcare system and show how, despite its shortcomings, it's not quite as skewed on the side of being all about profits at the expense of people as it's made out to be. Now, I understand the arguments that people make against the healthcare system in the United States, but I think we need to be very fair, or more fair than we are when talking about it. So I'm going to ask some questions and then attempt to answer them as best that I can to try to gain a better understanding of healthcare in the United States. So here we go. Let's jump into the first one. The question is, what do you do if you have a medical emergency but don't have health insurance? Now, the answer to that question is in the form of the EMTALA, or the Emergency Medical Treatment and Labor Act. The act basically requires hospitals to accept patients regardless of their ability to pay or insurance status. Hospitals that refuse this obligations are dealt with a monetary penalty if they don't. It isn't true that you will be turned away at the hospitals. Anyone who rocks up, whether they're a citizen, a non-citizen, a person traveling, will be treated as a first priority to ensure the life and well-being of the person. Now, the second line of defense in answering this question has to be charity care. The second line of defense for healthcare in the United States for those without health insurance policies in the United States is charity care. And charity care is the health care services received by uninsured individuals that they do not pay for themselves are picked up or absorbed by a number of parties, including practitioners and institutions, both public and private, that serve the uninsured at no charge or reduced charges, the federal government, localities, and states that support the operation of hospitals and clinics, both through direct appropriations and implicit subsidies like the Medicare and Medicaid disproportionate share hospital payments, and, of course, philanthropic donations. So to say that people in the United States are not supported by hospitals and doctors because they can't pay is just not true. So what is the value of this cost, or this charity care? What is the value of the cost of charity care? I found a bit of research on it, so I'll just read here. The best available estimate of the value of uncompensated healthcare services provided to persons who lack health insurance for some or all of a year is roughly 35 billion annually, about 2.8% of the total national spending for health care services. The numbers are quite staggering, and I hope it will dispel the myth that people are not getting treatment and care in the United States, because they are. I'll give a few examples. At Intermountain Healthcare, which is one healthcare provider in Utah, we have figures for charity care spending. It says, based on Utah State Tax Commission standards, Intermountain provided adjusted charity care of approximately $246.7 million in 2018 and approximately $225.3 million in 2017. And a report from a number of hospitals in the Washington area disclosed their charity spending. Quote, Washington hospitals reported $772 million in charity care charges in the financial year of 2016. Charity care was 1.18% of total hospital revenue and 3.12% of adjusted non-net Medicare, non-Medicaid revenue. So those numbers are quite considerable. A lot of money is spent on people who cannot afford it for whatever the reason may be. It is a burden that the system absorbs to get people the cover that they need. Moving on to the next question. How many people have health insurance in the United States? I must admit that I was quite shocked when I read this as well, because I was under the impression, as many people are, that coverage rates are quite low. But the opposite is true. And I imagine that if I was to ask a number of people in the streets who come from countries where the government runs the, say, healthcare system, I imagine the guesses that they would make would be that people in the United States have very low rates of health insurance. But we have the figures, we have the information on there. The census reports on the number of insured individuals in the United States, and the figures are quite promising. The system as it stands, with a combination of employee, private, and government programs, all make up the total rate of health insurance coverage. I'll read from the census. The percentage of people with health insurance coverage for all or part of 2017 was 91.2%. Not statistically different from the rate in 2016, 91.2%. Between 2016 and 2017, the number of people with health insurance coverage increased by 2.3 million, up to 294.6 million people. So I hope people hear that and understand that despite its shortcomings, despite the challenges of healthcare in the United States, the system as it stands is able to cover a considerable number of people, 91.2% of the population, with the system as it stands. And the big question is what to do about the 8% that don't have insurance. That's what Barack Obama's Affordable Care Act tried to address, was that 8% who don't have health insurance. So are we dealing with an issue as they portray it in the media, say, that no one else has health insurance? No. We're dealing with an issue of how to give 28 million or so people, 8% of the population, health insurance. How do we go about doing that? It is far easier to insure 8% of people than it is 91.2% of people who already have it. So we should be very clear about the issue that we're dealing with here. So just to describe some of the programs that we have, the poor in the United States are given options and are supported by the government. The Health Insurance Association of America describes Medicaid as a government insurance program for persons of all ages whose income and resources are insufficient to pay for health care. Medicaid is a large source of funding for medical and health-related services for people with low income in the United States, providing free health insurance to 74 million low-income and disabled people, which is 23% of Americans, as of 2017. Once again, the myth that the United States does not care for its people is just not accurate. There are options for people who can't pay. The next question I want to address, or the next myth that is surrounding healthcare in the United States, is healthcare all about profit in the United States? The simple answer is no. It's part of the program for some hospitals, but not all of them, of course. Here's a breakdown of the hospitals below, and we'll see that for-profit hospitals make up a minority of hospitals in the United States. Nonprofit hospitals are tax exempt and must provide a community benefit. And I talked earlier about charity care, and in order for hospitals to remain tax exempt, they must provide a community benefit, and for many hospitals that comes in the form of charity care. And I should say, the number of hospitals in the United States that are for-profit are less than those that are non-for-profit. So the number of non-government, not-for-profit community hospitals is 2,937. And the number of investor-owned for-profit hospitals, those that people have the greatest issue with, I would say, is 1,296. So there are more nonprofit hospitals in the United States than there are for-profit hospitals, which suggests something different to me, that there aren't just large groups of people who are ripping off the poor or ripping people off in the United States and, taking advantage of their poor health. There is a combination of for-profit and non-profit hospitals that have different aims in one sense, but in the other sense, they would have the similar aims to provide care and services to people who need them. So I hope that gives some perspective on healthcare in the United States, or at least the services that are provided. It's not all about profit, and there are many, many hospitals that are not for profit. And I'll just make the case. Profit is part of the program for some healthcare organizations, but as I said, not for all of them. But I should add that there is no shame, or should be no shame, in wanting to make money or turn a profit. For any person that's owned a business or has struggled to have a positive cash flow or have money coming in, what are the issues from that? The issues are not being able to pay staff on time, not being able to fund research and development, etc. So I don't think there should be any shame surrounding wanting to make profit or to make money so that there is some excess on the services that you're providing. That makes the economy go around. Profitable businesses endure, and those that are not fail and are usually replaced by those who can. Now, I hope this gives an overview and addresses some of the myths around healthcare in the United States that is often promoted by people who advocate for Medicare for all or other similar programs. And I'm not stating these details to prevent change in the healthcare system in the United States. I want it to change just as much as any other person, but we have to be clear about what we're dealing with and be fair with how we treat the problem. Perpetuating myths will not benefit anyone in this challenge to deliver quality, affordable, and accessible healthcare to the people of the United States.